Hi there, my name is Jessica Cook, and I'm a physical therapist and the owner at Cook Physical Therapy. Being that this is the anniversary month for KPT, I wanted to come on and share a little bit about how I've been dealing with treating bedwetting issues, daytime leaks, encopresis, stool leaks, toilet refusal, constipation issues. It's been a wild year of treating all sorts of issues. And a lot of parents and providers have a lot of questions. So I wanted to come on and explain a little bit more about it. That way, if it's something that you can kind of get some takeaway points for your own patients or for your child or for somebody else in your life, I want to be able to help you with that. So first off, potty problems are very vast and multifactorial, which is why it's very important to have a pediatric pelvic health evaluation, because if we look at just one little snippet or one little area and miss the big picture, there's a lot that could be missed and we could end up not fixing the true problem. So it's really important to determine the why of what's going on, first and foremost, to figure out what's going on and why it's happening. That way we can truly fix it and not just cover it up for a little bit and then deal with it again in the future. So there's a lot that we need to work on. We look at primitive reflexes, we look at diet, bladder irritants, bowel and bladder habits. I take into account sensory and interoception issues. We check strength, posture, the overall pressure system of the core, the pelvic floor, which I'll get to in a little bit also, and then the big one is constipation. So I feel like if we would talk about all of that stuff, I could talk for hours and probably bore you to death because I get really excited about it. And I know that not everybody feels that same way. So I wanted to focus specifically in this video on constipation, because no matter how complex the issue is, most of the issues involve or stem from chronic constipation. So that's what we'll focus on today. I don't know how many times over the past year I've heard parents say, well, my kid's not constipated, they poop every day. Or that they just automatically rule that out. But until we start actually talking about what typical signs of constipation are, then it's like a light bulb goes off. So I want to make sure that people are aware of what constipation truly can present as, because it's not just, if your child poops every day, that they're not constipated. So some major signs of constipation are very, very large stools. So that can mean that that stool is hanging out in the rectum too long and it's getting too much to where finally your child can't hold it any longer, and then it results in very large stools. Firm stools can be a big sign of constipation, especially like little marbles. Stool accidents, skid marks, an itchy anus, anything like that can be also signs of constipation, as well as super loose stools. So especially if there would be a blockage or a backup in the colon and the rectum, in that whole area, you can have super loose stool actually sneak past it, which can end up confusing parents thinking that your child's not constipated whenever they actually are. Bedwetting, urine accidents, recurrent, like frequent UTIs or urinary tract infections, urgency and frequency as far as urination. Like if your child is constantly running to the bathroom, or they're going all the time, or they have to get there really fast, those can all be signs of constipation as well. This one seems like an obvious one, but if your child's not having a bowel movement very often, that is a sign of constipation. However, if they're having bowel movements too often, so like if they're going more than twice a day, then that's a sign of constipation, because that means that their rectum isn't fully emptying and it's not having an efficient bowel movement each time. So they're having to go more often. Belly pain, that's a pretty obvious one too. A lot of kids complain of belly pain. But then also if you're having a hard time potty training, or if they're hiding to poop in diapers, anything like that can all be signs of constipation. So if you kind of think about, other than what people typically think of constipation, if you think about what I just all mentioned, think about your child, think about your patient, and then we want to think about, why is this so common right now, especially? It's kind of an epidemic of itself, is constipation right now, and that's likely because over the years, our kids, their diets have changed. Foods are much more processed now. Kids are getting less fiber, less fruits and veggies. They're getting less activity, so they're not out running and jumping as much. They tend to have more video games, more electronic time. That can be a big issue. Toilet seats have gotten a lot higher over the years. So whenever we used to have those shorter toilets, now a lot of them are elevated to be able to make things more accessible and friendly to our aging population. That's actually a lot worse for our kids. So if they're kind of clinging on for dear life on a tall toilet and their legs are dangling there, that means that their pelvic floor is firing that whole time, trying to hold themselves on. Well, you can't have a good bowel movement, or you can't eliminate well if your muscles are firing constantly. So toilet seats can make a big difference. There could be withholding patterns because they've either had painful poops in the past, or they potty trained too early and couldn't recognize the urge of whenever they truly have to go, or not wanting to take the time to go. So they're too busy playing, they're too busy doing other activities that they don't want to take the time to respond to an urge and actually go to the bathroom. So knowing kind of all of that, the solution is not as simple as just taking Miralax. It's way more complicated because the problem is way more complicated. So in here at KPT, we focus on diet. So trying to get more fiber, more fruits and veggies, avoiding certain bladder irritants, making sure that they get enough fluid intake. We want to make sure that they're having soft daily stools. So whatever we need to do in order to achieve that, I try to go as natural as possible. But that's how we want to kind of minimize or prevent constipation. We talk about toileting posture. So if you've ever heard of a squatty potty, it's a very real issue and it's a very real fix. So if we can elevate those knees to where they're higher than the hips, and if we can put a step stool underneath a child's feet, or an adult, it works for adults too, we can let that pelvic floor relax. That way you can get a better bowel movement. So we talk a lot about toileting posture in here too. I teach belly massages to help facilitate a bowel movement. So if you have stool all backed up in your belly, helping kind of facilitate that and push things along can make a big difference. There's all sorts of tips and tricks that we go over in here, but those are at least some of the main ones. And then we also look at the pelvic floor. So we need to make sure that those pelvic floor muscles are strong enough to be able to hold stool and urine in, but that they can also relax enough to let everything out. And that's a really big key point, because especially with the kiddos that are withholding and they're fearful of pooping, they want to hold it all in, those muscles can be really, really tight. And we need to be able to treat them to be able to relax, to let everything out that needs to come out. That way it's not backing up and causing a problem. So the way that usually looks, it's a visual exam for the pelvic floor. So nothing goes in anywhere, there's no touching. It's just a visual exam to see what's going on. And we can also use biofeedback, which is a great tool to be able to see what those muscles are doing. It just uses little electrodes that give us a signal then to know if those muscles are firing too much or whenever they shouldn't, or if they're able to relax enough. But the pelvic floor exam, I always teach the kiddos, there has to be 3 rules. The child has to give consent, the parent has to give consent, and a pelvic floor exam can only be performed by a medical professional who is trained to do this. So if the child's not willing, we're not doing it. If the parent's not willing, we're not doing it. So we have to have all 3 things in order to progress. And if a child's not willing, that's okay. You know, we've found several modifications over the past year of ways that we can kind of get around that. We still want to see what's going on at the pelvic floor, because that's a big aspect of what's going on. But you know, if a child's not comfortable with it at the evaluation, or if they're not comfortable with it a couple weeks later, we can work with that, because I always want to make sure that the patient feels safe and secure and everybody's comfortable with what's going on. So being that how important it is to address constipation, we want to make sure that we address it now as a child, because if it's not addressed now, those constipation issues can last all the way through adulthood. And we know that especially if the cause is constipation for bedwetting, then that means that bedwetting is going to continue as well. It's not something that they're necessarily going to outgrow if they're really backed up and a backup of stool is pushing on the bladder and causing all these bladder leaks. So it's really, really important to figure out what's going on, address the issue as soon as possible, because recovery and healing and results come a lot faster the sooner you can get on board with it. So if all of this is sounding all too familiar, if you're having troubles with potty training, if you know that constipation and potty problems kind of run in your family, reach out to me. Let's chat. Let's see how I can help you. Let's see if we can get things figured out, because this, like I said, the sooner you start, the faster we can get results. And we want to make sure and address it sooner than later. So that's kind of about what pediatric pelvic health is, and kind of a quick rundown on constipation, because like I said, I could talk for probably hours. But what does a program look like at Cook Physical Therapy is another big question that I get, and I want to make sure to address that right away too. So here at KPT, I give hour-long sessions. Every single one's an hour long because it's so involved that I want to make sure that we can have the time to be able to truly focus and give you what you need. So being that we need to dig into all of it, the first few sessions especially are nice to do like one time a week for the first few weeks, because there's just so much to cover, so much to kind of dig into. Then after we have that good base, once we kind of know what's going on, once you have kind of the tools in your toolbox on how you can treat things at home and work on things at home, then we can start spacing things out. On average, a plan of care or a program here lasts for 4 to 8 visits. So it can be a really long process, especially if your child's had constipation for years. It can take a long process to kind of work through everything and to have that healing. But my goal is to address the deficits here in the office and then equip you with ways to manage and prevent constipation in the future. Because just because you fix it now doesn't mean that they're not going to become constipated whenever you go on vacation next summer, or whenever they switch schools, or whenever there's some other big change. I want to make sure that you're ready to tackle whatever comes your way in the future as well. So the take-home point, or kind of an action step that I want to make sure and give you, because I don't want you leaving here with feeling like, well, what do I do other than schedule an appointment? Because there are lots of things that you can do at home. Start paying attention to your child's bowel movements. So pay attention to the consistency of it. Is it loose? Is it hard? Do they have to strain, or is it painful to go? How often do they actually go? How much water are they drinking? Because ideally you want to shoot for about half of their body weight in ounces. That's a good way to get a lot of fluid in, to make sure that the stools are staying nice and soft. Try using a step stool. Heck, parents, try using a step stool. It makes a difference for everybody, not just kids. So see if you can get their pelvic floor to relax better on the toilet. That way they can have a better bowel movement, and then we can get some relief from those bowels. If it seems like your child is constipated, or your patient is constipated, if you are having potty problems or wanting to prevent potty problems, give me a call, give me a text. You can text my work number also. I have online scheduling at cookpt.com that you can always schedule or message on there too. I truly want to help families fix their potty problems, because I know that it can be very stressful. It puts a lot more strain on the family relationships. And if that's something that I can help with, I want to do that. I want to make a difference in your life. I want to make a difference in your family's life, and I'm here for you. So let me know how I can help you, and I'm here.